The overall theme that I want you to remember as you leave is that if you're a physician, I think there's never been a greater opportunity for us as a profession to shine and to lead us through the change that has to happen. If you're not a physician, then I would ask that you hold the profession accountable for this change that has to happen. And if this change doesn't happen, I can predict that within the next 15 years, there will be no medical profession. The profession as we know it will disappear. I'm going to talk about three things: healthcare transformation, health equity, and advocacy. So if we're going to talk about healthcare transformation, that's how to change this monster that's been created across the country that's consuming about $200 billion. Health equity is talking about how if you want to be healthy, the last thing you should do is interact with the healthcare system. And the last one is advocacy and how we can advocate. So if we start off with healthcare transformation, then the first theme of them all is this one. Our unique role as physicians is that we're prepared, have always been prepared, to accept the ultimate responsibility. For the person that comes in with a regular cold, you actually don't even need a physician. We used to have a lot of collective wisdom in medicine within families. We've lost that. And so now by default, our healthcare system has to serve purposes that it really wasn't designed to serve. That's the most difficult thing to do in medicine, is to get the right diagnosis. Once you have the right diagnosis, it really becomes a little easier in how you manage those patients. And that's where teams could play a bigger role. But make no mistake about it, there is only one member of the team that accepts responsibility for our sickest patients, and that's physicians. We have no trouble training our nurses and pharmacists and doctors in terms of how to take care of patients, but we rarely, if ever, teach them how to take care of these complex systems that they work in. Physicians should be setting the tone for how to approach problems if problems exist within a system, right? But we don't do that. We spend $2.8 trillion in the US and Canada every year on healthcare costs. And the National Institutes of Health, the Institutes of Medicine actually, took a look in the United States at how these dollars were spent, and this is what they found. $210 billion in unnecessary services, $130 billion in inefficient delivery, $190 billion in excess administrative costs, $105 billion in inflated prices, to the tune of about $750 billion a year in the US are wasted on healthcare every year. That's 4 times the annual budget of the Canadian healthcare system. But till somebody gives me Canadian figures, and these studies haven't been done, we'll just have to assume that a sort of a similar amount of waste exists with our system. Maybe less in terms of administration, because we're not as administration heavy, but nonetheless, there are dollars that could be better spent. So the whole point is we need excellence in governance, not only from the administrative perspective, but whoever leads the subunits within the institutions. The other thing we need is accountability. But in Canada, we have pockets of excellence, maybe, but by and large, we have no accountability. So how often do you guys, work on crucial conversations? And is everyone within your organization trained to know how to have crucial conversations? Because if you can't, then you're not going to be able to talk about accountability, and you're probably not working in an institution that really strives on high-level governance. If you believe that just trying to fix the system is going to fix things, well, you'll get some sort of benefit, but you're not going to get the kind of changes that we need. The real gains are if you understand what makes people healthy. So the narrower that gap between the high-income earners and the low-income earners, the healthier the society is. Obviously, right off the bat, our systems are not designed for the convenience of our patients. They're designed for the convenience of the healthcare providers. Like emergency departments, it's not rocket science. We know exactly when the patients are going to come in every day. And yet our staffing has never been adjusted to reflect when the patients show up. You have to ask patients about their economic needs. It's not embarrassing to say, are you able to fill this prescription? Are you able to take a cab? Or have you got the means to come back for your intravenous therapy every 8 hours? Unless we ask these things, we're not going to be able to help them out. So you get the gist of this. No sense having a practice 9 to 5 if the poor mom that has 3 single kids has got 3 jobs during 9 to 5, right? So you've got to tailor the delivery of services to meet the needs of your patient. The good news is in 2013, we know how to keep people healthy. Unfortunately, the healthcare system is consuming the majority of the resources so that we can't focus on the most important members of our society, and that's kids under the age of 18 months. The healthcare system may contribute 25% of your health. 75% of your health comes from income, early childhood development disability, and the list goes on. 15% is biological. You either have inherited the right genes or not. And the last bit comes from the environment that you're in. But if we're going to be planning for the future, then what we have to say is, okay, well, wait a second. We've got to wean ourselves off this addiction we have to healthcare and reinvest those dollars in early childhood development and in the community and in the things that make people healthy. These are the foods you need to eat, right? These are the only foods you need to eat. These are called super healthy foods. Okay, so wild salmon, not farm salmon. I always get in trouble for saying that. You know, turkey that doesn't have any skin on it, yogurt, any of the berries, any of the spices, any of the nuts, alpha-3 omega eggs, spinach, broadleaf, anything that's very colorful, and broccoli. There's actual physicians that believe that we have enough knowledge today to really start the conversation about ending illness. Smoking, inactivity, and poor nutrition. Okay, those are the 3 risk factors. Contribute to 4 diseases. Put up 4. So certain cancers, diabetes, chronic pulmonary conditions, and cardiovascular disease. All right? And those 4 conditions account for 50% of the disease burden. You know, we're chronically fatigued as a society. And fatigue has a direct impact on our health. The other one is substance abuse. And the other one is mental illness. But you know, you really don't want to call it mental illness. You want to call it brain health. All right? Because mental illness carries a certain stigma to it. Yet we know for a fact that mental illness is very prevalent within our society, but we're still not comfortable talking about it. The good news is that the Federal Minister of Health has signaled that she is very interested in working on some of these issues. The presentation, hopefully, is a call to the profession to rally behind the Canadian Medical Association in trying to engage physicians to understand that society is losing its respect for the profession. It's up to us now to make absolutely sure that we listen to these messages, get on the same page, and align our thinking